But the big takeaway from all this, guys, is if you're using a paralytic, make sure your patient is adequately sedated. If you're aware and you're paralyzed, it can be very traumatic, and this is something that we do not want for our patients. Okay, I see. Well, let's get you educated. So we use paralytics and neuromuscular blockade agents quite frequently in the ICU, and off the top of my head, I could think of 3 reasons why we would use neuromuscular blockade agents. The very first reason, which is probably the most obvious, is whenever we need to intubate a patient. So anytime we need to put a breathing tube into a patient, more often than not, we'll be using a paralytic for that. So another reason that we use neuromuscular blockade agents or paralytics in the ICU is to facilitate mechanical ventilator synchrony. So what does this mean? Sometimes our patients will be fighting and bucking the ventilator, which don't allow the ventilator to do its job, which is to deliver oxygen and to keep the alveoli open. So whenever we deliver a paralytic, it allows us to deliver these respirations in a meaningful way instead of